is Mackenzie Meldrim. My student ID is 3254433, and this is for my Clinical Pathology 2 class. In this video, I'm going to demonstrate how to collect the sample and evaluate the samples for dermatological and fungal testing. In this case, we're going to be looking for a fungal organism known as dermatophytes. Dermatophytes are found on the hair shafts of dogs and cats, and they can cause irritation. So when a dog or cat suspected of having a dermatological issue comes to the hospital, they are going to present with scaly skin, active lesions of hair loss, and some broken hair shafts. So what I'm going to be using to collect my sample is I have my medium. This is a dermatophyte test medium, or a DTM, and I have my sterile hemostats that I'm going to be using to pluck the fur from my active lesion. There are other ways that you can collect samples. You can use a toothbrush to brush the scaly skin. You can use a swab applicator to do something similar. In this case, we're going to be using our hemostats. And I have my gloves so that I'm not coming in direct contact with a potentially hazardous organism. So first thing I'm going to do is I'm going to look for a spot. So this cat doesn't have any dermatological issue, but if he did, I would be looking for an active lesion, and I'd be looking on the periphery of it to look for any broken hair shafts and scaly skin. So this is the spot we're going to be using here, and I'm going to clean it with soap and water to make sure that there's no any contamination. And I'm going to open my DTM. So I have my sterile hemostats, and I'm going to pluck hairs from the periphery of my lesion. I don't know if you can see it right there. Okay, so I have my hairs. This medium has dual sides, so I'm going to be inoculating it using both sides. So I will put my hair sample in, and I'm going to push it down a little bit into the medium. And I'll take some of them and put it into this side as well. Do the same thing, push it into my medium. And when I cover it, I'm not going to cover it like tightly, so I'm going to put it lightly on so that it's not completely on. And I'm going to take my medium and I'm going to let it incubate at room temperature, and I'll keep checking in to see if there's any growth or color change that would indicate a positive culture. So it's been a few days since I set my culture plate to the side to let it incubate. So now we're going to take a look, see if we have any growth or color change. And right off the bat, it doesn't look like, at least visually, that there is any growth. So at least visually, I would consider this a negative sample. We're still going to look at it microscopically to make sure we don't see any dermatophyte spores. So the first thing I'm going to do is I'm going to take my methylene blue dye, and I'm going to put a drop of that in the middle of my slide. And I'm going to take cellophane tape, and I'm going to put it sticky side down into my medium so that any spores will get picked up by the sticky part of it times. So now I'm going to place that onto my slide, sticky side down, and it acts as its sort of own cover slip. So now that we have that, we're going to look at it under the microscope at a low power, see if we can see any spores. So far, nothing. Yes, so this sample is negative for dermatophyte spores, so we would consider this culture negative. In this video, we're going to demonstrate how to perform a necropsy. A necropsy is a post-mortem examination performed by a doctor, usually at the request of an owner after an animal has died. Most necropsies are performed on animals that have died of an unknown cause, and the owner wants some peace of mind as to how that happened. They can also be performed for scientific or educational purposes, and they can also be very helpful with diagnosing future patients, if they have similar symptoms. So Dr. Goldman is going to be performing the exam, and I'm going to be assisting him. And you'll notice we are in our personal, our PPE, our personal protective equipment. We have our masks, we have our gloves, we have our gowns. And this is to make sure that any potentially harmful materials or substances don't come in direct contact with us. So we have our equipment here. Dr. Goldman has his scalpel handle and his blade, which he's going to be using to open the body up. And he has his forceps, which he'll use to collect samples. We also have our 10% formalin jars that we'll be using to hold the samples in if we need to bring them to the lab. So the first thing Dr. Goldman is going to do is he's going to perform an external examination on the animal. And basically he's just going to look it over, see if there's any lesions, any injuries, anything abnormal that might have contributed to the animal's death.
So looking at this bunny, it does have a bunch of blood around its face. It could have been hit by a car. A little bit of dental disease. There's no sign of external parasites, and bones do seem okay.
And as his assistant, I'll be making any notes of anything that comes to mind, anything abnormal that he notes. I'm going to be writing down so that he can take a look at it later if he needs to. Okay. So now he's going to be making his ventral midline incision to open the body up. And then once the body is open, he's going to perform his internal examination, which, just like the external one, he's going to look at the organs, look to see if there's anything that could have contributed to the animal's death.
An incision to get into the abdominal cavity. Okay, reveal animals' internal abdominal organs. If I also have a pair of scissors, which I'll get in a moment, we'll get into the chest cavity. So, looking just at the external organs, rather internal organs, intestines seem okay. We'll sample them just in case. Stomach looks fine. Kidneys look okay.
It should also be noted that a lot of times after death there are changes to the organs, but they would all be considered post-mortem and not contributing to the death.
Nothing else seems of excitement there. We're going to get some biopsy samples.
So I'm going to take my formalin jar. I'm going to uncap it. Looks like we're getting a bit of the intestines.
Yes, our intestinal sampling.
Yep. And I'm going to hold it out to him so that he can drop the sample in without it being contaminated. And then I will close my jar, and then to make sure that there's no confusion as to whose sample this is, I will write the patient's name and the owner, if there is one, along with the date and the type of sample that it is.
Next, going to get a kidney sample.
And for the purpose of this demonstration, normally you would have different jars for different samples. In this case, we're just going to be using the same jar. But again, normally you would have them in their own separate containers.
Going to get a sample of stomach. just need to be ingested in the stomach. Okay.
Okay, and then once we've gotten all these samples that we need, the doctor will then sew the animal back up, and then it can be processed and sent out for cremation.
All right. Otherwise, this one looks okay, besides it unfortunately being deceased.
So in this video, I'm going to demonstrate how to perform a vaginal cytology. Vaginal cytologies are useful in determining the stage of estrus that a female dog is currently in. It's also helpful in determining if an infection is present. So the first thing I'm going to do is I'm going to have someone hold the tail out of the way, and I'm going to clean the vulva with my chlorhexidine and my saline, my sterile saline. And we're just going to mostly get all this hair out of the way. Just going to clean it around there. Alright, next thing I'm going to do is I'm going to open my sterile applicator swabs, and I'm going to moisten the tips of them with more saline. And I'm going to insert my swab at a 45-degree angle into the vulva so that I can advance it into the vagina. And I want to rotate it around a little bit so that I can get some of the cells on the vaginal wall. Hold on. And I'm going to take my microscope slide, and I'm going to gently roll my swab onto it. And I'm going to take my slide to the microscope so I can take a look at it and see if I can identify the stage of estrus that this patient is currently in. Okay, so before I go about staining my slide and looking at it under the microscope, I'm going to quickly go over the 4 stages of estrus, give you a few clinical signs and signs that you would see under the microscope. So the first stage is called anestrus, and depending on your textbook, it can also be called diestrus. And there's not very many clinical signs, but under the microscope, you'll see basal and parabasal cells, and sometimes some intermediate epithelial cells as well. Our next stage is proestrus. Proestrus, you're going to start to see some swelling of the vulva and some reddish discharge. And the female dog, she's starting to attract male dogs, but she's not going to accept them. And under the microscope, you're going to see some more, your parabasal cells and your basal cells, they're going to become more intermediate, start to get cornified, and you're going to see more red blood cells, hence the reddish discharge present. Our third stage is estrus. Estrus, you're going to see even more swelling of the vulva, and you're going to see more of a pinkish, straw-colored discharge. And all of our non-cornified cells, all of our epithelial cells are all going to be cornified now, and what that means is they're basically angular in shape, and most of them are going to be anuclear, so they don't have nucleus. Lastly, we have our metastrus. Metastrus, you're going to see a little bit decrease of swelling of the vulva, and there's not going to be as much discharge. And under the microscope, you're going to see that all of your cornified squamous epithelial cells, they're all going to become non-cornified, and they're going to all revert back to what they were in an estrus. So now that we've gone over our four stages, I'm going to stain our slide. So it doesn't need to be heat fixed, but we are going to put it in the fixative for 10 seconds. And then we'll move on to our eosin stain. So we'll put it into our eosin stain, cover up our fixative. And then next we'll put it in our methylene blue stain. And then after that I'm going to basically get rid of any excess stain that's on my slide by putting it under the water. And I'm going to dry it using my hair dryer over there. This up. So now I'm going to place my my slide under the microscope and get it under lowest power right now. Find my place. Into my next highest power. And now I'm going to use my little immersion slide. Alright, so right off the bat I can see it looks like a parabasal cell. It looks kind of it's circular in size, and it's pretty it's not the smallest size that it can be, but it's pretty small. I'm also seeing a little bit of bacteria, which can be normal flora in the vagina. Still seeing another parabasal cell. Some debris. And I actually see, right in front of me, I see an intermediate cell, so that's going to be a little bit bigger than the parabasal cell, and it still has the nucleus, so we can infer that taking all this into account, as well as looking at the clinical signs of the dog, there wasn't any swelling of the vulva, there wasn't any discharge present. We can take into that account and say that this dog is probably in an estrus. In this video, I'm going to be demonstrating how to perform a cross-matching agglutination test. This is to test the blood of either two dogs or two cats to see if their blood type is compatible enough for a blood transfusion. So first thing you'll need blood samples from a donor animal and from a recipient. So as you can see, I've already gotten my blood. I have my clotted blood with my serum in my red top tube, and I have my anticoagulated whole blood in my EVTA tube. So the first thing, actually I've already done this step, but you want to centrifuge all four of your tubes. So I have my serum from my clotted blood, and then I have my plasma and my packed erythrocytes, or my red blood cells, at the bottom of my EVTA tube. So our first step is going to be to take our serum from our clotted blood, and as you can see, I labeled all of them so I don't have any confusion. So it's going to be going into this tube, and we're going to be putting them to the side for later use. Okay. So that's our donor. And now for our recipient. Alright, so we'll put those to the side for now. We'll be using them later. And now my next step is going to be, I'm going to take my plasma, and we're not going to be using it. We want our packed red blood cells at the bottom, so I'm going to be taking my plasma, getting that out of the way. for now. Okay. That's for my donor. Now I'm going to do my recipient. Okay, so now what I'm going to be doing is I'm going to be placing about 2 drops of my packed red blood cells into these plain tubes. Okay, so that's for donor. And okay. So now what I'm going to do is I'm going to fill each of them up with my 0.9% sodium chloride, my saline solution. I'm going to fill up the whole tube. And this is known as erythrocyte washing. And I'm going to be centrifuging both of them in my centrifuge for about a minute at 3,400 RPM, and then once we're done, we'll move on to the next step. You want to make sure that it's gently mixed, okay, and I'll do that for the other one as well. Okay, so now that our packed cell saline mixtures have finished being in the centrifuge, you can see that I've actually done this 2 extra times. You want to do your erythrocyte washing at least 3 times. So I've already gone ahead and done that, and you can see that they're thoroughly washed by the lack of color in the supernatant. It's clear, it's colorless, so we know that they're thoroughly washed. So what I'm going to do now is I'm going to pour off my supernatant. Alright, and all that I have left is my packed red cells. So what I'm going to do now is I'm going to make my erythrocyte suspension. It's going to be 2%, so what I need is 0.02 mLs of my erythrocytes, and then I'm going to fill the rest with 0.98 mLs of saline. And this one just happens to be for the recipient. So I'm going to do that. Too much. To put that in my recipient labeled cell suspension tube. And then I'm going to fill the rest of that up with my saline. And then I'm going to mix that together. So I'll put this to the side and I'll do the same thing for my donor cell suspension as well. So now that we've finished putting together our cell suspensions for our donor and our recipient, we can go and actually start to do our testing. Cross-matching actually has 2 parts to its test. There's the major cross-match and the minor cross-match. The major cross-match tests the compatibility of the recipient serum to the donor red blood cells. And the minor cross-match does the exact opposite. It tests the donor serum to the recipient red blood cells. So what I'm going to do is I'm going to take 2 drops of each, 2 drops of my recipient serum, and put 2 drops of my donor serum, my donor cell suspension, and that's going to be my major, and then 2 drops of my donor serum and 2 drops of my recipient cell suspension, and that's going to be my minor. So I have new tubes. So I have my major, and I'm going to take 2 drops of my recipient serum, put that in there. And then I'm going to take my donor cell suspension and put 2 drops of that in with it. So now I have my major cross match right here. And next I'm going to do my minor cross match. I'm going to take my donor serum, drops in there, and I'm going to take my recipient cell suspension, put 2 drops of that in as well. And because we need something to compare our results to, I'm going to be making 2 controls, one for my recipient and one for my donor. So I've already gone ahead and I've already made 2 cell suspension for my donor and my recipient again. So what we're going to do this time is, so I have my recipient tube here. I'm going to take 2 drops of my recipient serum and 2 drops of my recipient cell suspension and make my control that way. This is why you label everything.
Do we know anything about this cat?
So this is going to be my recipient control, and I'm going to do the same thing with my donor. Donor serum. And then my donor cell suspension. So now that all of my tubes have been made, I'm going to let them sit for 30 minutes at room temperature, and then I'm going to centrifuge them for 1 minute at 3,400 RPM. So our major and our minor and our controls have all sat out for 30 minutes, and they've all been centrifuged. So we're going to take a quick look to see if we can see any agglutination present. So here are our major and our minor. You can see a little bit of what I would consider agglutination, but we'll double check in the microscope. Or under the microscope rather, and our controls, as you can see, not much going on there in way of agglutination, so that's good. That means our controls worked. So what I'll do is I'll take a drop of, start with my major, and I'm going to put it onto my microscope slide with a cover slip, and we'll take a look under the microscope. And then I'll take my minor as well, and then we'll bring it over to the microscope. So now we're going to take a look at our slides under the microscope to see if we can see any agglutination microscopically. So the first thing we're going to do is we're going to look at our controls. And our controls should not have any agglutination present if they were done properly. So we'll go ahead and take a look at it under low power. We're going to turn our condenser off so that we can see better and adjust our vision. And so right off the bat I can see that there doesn't appear to be any agglutination present here, but I'll look at the slide just to make sure. Okay, so that was our donor control, so I'll go ahead and switch to our recipient control.
Did the pancreas enzymes come in today?
Right. And again, I'm seeing a lot of the same. There's no agglutination. The cells are all pretty evenly dispersed. Okay. So now we're going to look at our major and our minor cross matches. And just looking at it, I can already see that there is some agglutination present here. They're all kind of clumped together in certain spots, almost like a clump of grapes. So this would indicate that this is not compatible with the recipient. But we'll take a look at the other one just to make sure. Okay. So that was our major. Now we're going to look at our minor. And again, I'm seeing also some agglutination present. So since there was agglutination present in our major and our minor crossmatch, we can take that as an indication that our donor and recipient are not compatible for a blood transfusion.